Nurse, are you there?
I'm here, Lucy. My name's Paul. I'm one of the nurses who's looking after you today. What's wrong?
Oh, I really don't feel very well.
In what way don't you feel very well, Lucy?
Oh, I feel all peculiar and it feels like my heart's going 10 to the dozen.
You feel like your heart's racing?
Yeah, I really don't feel good, Nurse.
Are there any other problems you've got? Any pain, any discomfort?
No pain, Nurse, just this peculiar feeling in my chest.
Okay, Lucy, I think it's worth us doing some checks on you, so I'm just going to check some of your vital signs, okay? I'm going to be attaching a little bit of monitoring to you.
Okay, Nurse.
Well, she's talking to me, so I'm not worried about her airway.
So I'm just going to pop a clip onto your finger, Lucy, because that's going to help us monitor your oxygen levels, okay? Nothing to worry about.
Okay, Nurse.
I'm also just going to have a little feel on your chest there.
Her respiratory rate is higher than before, and her saturations have dropped. I don't remember her having any respiratory history.
Lucy, can I just check with you? Do you normally have any problems with your breathing when you're at home?
No, Nurse. Nothing with my breathing normally.
Nothing that the doctor's treating you for?
No.
Okay, don't you worry then. I think it's probably worth getting some oxygen for you there, okay? So I'm just going to pop a little mask on just to help with your breathing because your oxygen levels are a little bit low.
Okay, Nurse.
So this is just some oxygen, Lucy, okay? I just need you to try and breathe nice and easily for me, and that'll make you feel a little bit easier, I think.
Okay, Nurse.
Okay, Lucy, so I'm just going to have a look, listen to your breathing now. Just breathe away normally for me. And round the back. Well done, last time.
I'm happy that she has breath sounds throughout, with no added sounds. Her chest sounds clear.
Okay, so just while you're getting the benefit of the oxygen, I'm just going to do a few more checks if that's okay. I'm just going to pop some little stickers onto your chest so I can monitor your heart. Again, nothing to worry about and this won't hurt a bit. I'm just monitoring your heart rate. I'd also quite like to check your blood pressure, so I'm going to pop a little cuff round your arm for you. Okay.
Okay, Nurse.
Now this is going to squeeze a little bit tightly while it's checking, but it'll only be for a few seconds.
Okay, Nurse.
Okay, so that's going to get a little bit tight now.
I'm sure her heart rate wasn't that high earlier, and I'm sure from a medical history she suffers with hypertension.
So just while we're completing our checks, Lucy, I'm just going to check your temperature as well. Do you feel particularly warm at the moment?
No, not that I'm noticing, Nurse.
So I'm just going to pop this thermometer into your ear, just a slight pressure for a second.
That's fine. No concerns there.
Okay, so your temperature's nice and normal there, Lucy, so we're just going to carry on with a few more checks if that's okay. Would it be alright if I took a drop of blood from your finger just to check your blood sugar?
Yeah, that's fine, Nurse.
You don't have any problems with your sugars normally? You're not treated for diabetes or anything like that?
No, I'm not. I don't normally have to check my sugars or anything, no.
That's fine. It's just because you're in hospital and because we want to be nice and thorough, we're just going to check it this time. Okay, it's just a drop of blood.
Okay, Nurse.
Okay, so sharp scratch now. Just give it a few seconds for that to read.
That's normal.
That's super. No problems there.
I'm happy that she is alert and orientated. She just walked back from the toilet, so she's moving all her limbs. She's alert on the AVPU scale.
So Lucy, we've done lots of checks there, but I'd just like to get one of my colleagues, one of the doctors, to come and review you as well, if that will be all right.
Yeah, that's fine, nurse, thank you.
Is there anything else I need to know? Is there any other symptoms I need to tell the doctor about?
My chest feels heavy and it feels like it's a bit heavy.
Your chest feels...
This might be a problem with her heart.
Just recently started?
Well, when I got this peculiar feeling, I think, yeah.
Okay. And is it going anywhere else, that pain?
A little bit into my shoulder, but only a little bit. It's more in the middle.
Okay, and which shoulder particular, or is it both?
My left one, I think, nurse.
I see, okay. I'm just going to go and let the doctor know that I'd like him to review you. And I'm just going to have a little check through your medications chart on my way, okay, just to make sure that there's nothing I need to give you or nothing that we need to know about. But I'll go and get the doctor quite soon, okay?
Okay, thank you, nurse.
When I helped her into a hospital gown earlier, I didn't notice any wounds and no damage to her pressure areas.
That's fine. So I'm just going to go and get the doctor now, Lucy. I won't be far away though, just at the desk, making a phone call. If you need anything, just shout me.
Oh, okay, nurse. Thank you.
Hi.
Hello, is that the doctor who's covering Ward B3?
Yes, it's one of the F2s. Can I help you?
So, my name is Paul, I'm one of the staff nurses on the unit. I've asking you to come and see my patient, Mrs. Lucy Mills. I'm a bit worried about her because she's got some chest pain. I've got no analgesia prescribed to give to her, and her EWS is now 5. I'd really quite like you to come because I'm worried.
Okay, I'll be about 5 minutes, but could you redo the obs first, and then I'll be down?
Yes, I will. Yeah, that's fine.
Thank you.
Thank you.
I've come to review Mrs. Mills.
Yes, thanks for coming down, doctors. My name's Paul, I'm the nurse looking after her. I think I called you about her just a few moments ago. I think it was yourself I spoke to.
Yeah, can you just give me a bit of an update? Can you tell me what's been happening?
So Mrs. Mills came in after an episode of fainting at home. When I first assessed her, I noticed that her saturations were low, around 90 on room air.
Okay.
I've instituted 15 litres via non-rebreather. Her airway is patent. She is talking to me.
Right.
I've done some observations. She's increasingly hypotensive. She's tachycardic. She remains apyrexial. But I am concerned that she's complaining of some new central chest pain with radiation to her left shoulder. She's had no analgesia or other medications from either the ambulance staff or my colleagues while she's been in hospital.
Right, okay. And her temperature and BM have been okay?
So she's apyrexial, she's got no diabetic history, and her blood sugars were in normal range at 6.5.
Fine, and in terms of exposure, has she been up and out in bed and things like that?
So I helped her into a hospital gown. There was no signs of trauma, no wounds, and no signs of swelling or rash.
Okay, what I'd like you to do is go and give me some GTN first of all, come
Sure.
back and give that to the patient, and then when that's done, do a 12-lead ECG, and then tell me when you've done it. I'm just going to assess the patient, okay?
Okay, so just to be clear, you'd like me to get some GTN first, give it to the patient, you'd like me to do a 12-lead ECG and show you the results. Would it be helpful if I got the blood results from ED as well?
That would be perfect, that would be brilliant. Thank you very much,
Okay,
Beth.
thank you.
Lucy, my name's Laura. I'm one of the junior doctors. I just need to assess you.